Hi there. Hope you had a good weekend. Hope you're looking forward to having a great week. Just wanted to talk to you a second about um, one of the most common complaints we get here in our urgent care, and that is with joint injuries. Now, that's a huge topic, and we could just talk for years and years about it, but let's just talk about acute minor injuries to your joints and what to do. A lot of the complaints we get in this urgent care and in many urgent cares are acute injuries to ankles, knees, elbows, wrists, the different joints of the body from falls or slips or sports or other activities. And we come in, you can rule out serious injuries with x-rays and exam and getting a good history of what happened. And a lot of times, if we can rule out something serious, we can diagnose it as a sprain or some type of tendonitis or something like that. And a lot of times, you will have a provider tell you, "All right, well, we can just do this routine home care for your injury," or they'll say, we often use a mnemonic called RICE, R-I-C-E, and what that means is it stands for rest, ice, compression, and elevation. And those are the four things that really will help the pain associated with your injury and help it to get better faster so you can kind of get back to 100% as quickly as you're going to be able to. Now, just like everything else in life, the younger you are, the easier it will be to deal with. The older you are, the more difficult it will be to deal with. Adult ankle sprains will sometimes have adults limping for weeks, whereas you watch a 13-year-old sprain their ankle and they'll be up and running on at full speed within 2 days, no problem. So when you have a medical provider say, let's do routine home care for that injury, that sprain, that elbow injury, that knee injury, that ankle injury, they're talking about RICE. And first of all, they're going to tell you to rest it. They want you to not do as much activity. Walk on it less, run on it less. If you were playing a sport or a hobby that you got injured during, they're going to tell you to stop doing that for a few days. Rest it. This even goes for back injuries too. We want people to rest. I ask them to aggressively rest, which means be very intentional about their resting. Don't just say, okay, take it easy. I mean, literally try to plan your life to where you don't have to move as much as you normally do, and be very intentional about it. Be aggressive with your resting. Then ice. We basically want you to put some type of cold anything. We say ice, but they make special little things you can put in your freezer. We want cold on that area, on that joint, 15 to 20 minutes, no more than 3 to 4 times a day. That would be plenty. What does that do? Well, that's basically going to vasoconstrict the vessels that provide blood flow to that area and cause less swelling. The swelling a lot of times is where you get the pain. The swelling is a result from the body responding to that injury, to that acute injury that's happened there. And so the swelling is a result of that, and the swelling is often just the cause of the pain. The C in RICE, R-I-C-E, C stands for compression. A lot of times before you leave here, we'll put some type of compressive material on there, an ACE wrap, some Coband. Sometimes you can have a lace-up brace that you can tie tight that will provide compression for you. This again just helps reduce the swelling. It's all it really does. And then elevate. We ask you, if it's possible, to get that joint when you're resting it above your heart. So if you've hurt your ankle, we ask you to lay flat and elevate your foot above your heart. That way you can reduce the blood flow, which again will reduce the swelling, which again will reduce the pain. So our two goals when you hurt a joint is to reduce your pain and increase or get your joint back to normal as quickly as possible. And rest, ice, compression, and elevation, or the mnemonic RICE, is one of the ways we can help you do that. There's also a myriad of other ways that you can do this. Your provider, whoever's seeing you, will help you talk about what's best for you and your injury, and whether you need other consults or physical therapy or prescription medications, whatever they are, they'll walk you through that process. So please don't go roll your ankle. Don't hurt yourself. But if you do, seek attention, get some help. And if anyone ever tells you to do typical home care for that joint or RICE, you'll know exactly what they're talking about. Have a great week, and we'll talk to you soon.